Now I'm gonna make a series of 2 videos regarding how to make the putty. You have to make 2 types of putty, and actually 2 types of putty for 2 different positions. So I'm gonna divide these videos into one specifically for number 9, and then later I'm gonna make another one for number 3 and 5, and especially because we have to make it twice, because they request you to cut in 2 different ways, and they are going to use um, your own putty to evaluate your preps. Okay, so it's important that you do it well. So what you have to do, get putty. In this case here is regular set. I recommend to have fast set, because if you make it wrong, you don't lose time to do another one, because this one takes sometimes around 4 minutes to get ready, 4 to 5 minutes. So this is going to be for number 9. So first thing, you have to really mix it well. I've seen people doing this, and then when they do, they don't mix it well. So you see lines, residual lines of white and blue stuff. And you really have to make sure. I like to go not only with the fingers, but with the palm of my hands like this. You can squeeze a good amount of it faster. And it's important that you do it fast, because one of the things that is important during the exam is time management. So as you can see, I don't see white lines, so it's fine. So you can make something like with this shape, and then you go here, and then you apply from the K9 to K9, but make sure that you go with 2 fingers like this and one on the top, and you bring it down. And I really want you to make sure that you cover part of the tissue down here, okay? Because the tissue is going to be important, both sides. You have to have some tissue, covering some tissue here on lingual 2, because the tissue is going to stabilize the position of the putty when you're doing self-assessment, right? So we are going to do 2 of these for each. So while that one is getting set, I'm going to get more to do the second one, because as I said, we need to do 2 types of cut. And again, you're gonna leave your putty with them, so make sure you do it right. There is something that you can buy from Accidental. I can provide the link later. It's called Checkmate. It's like a frame that you can place here, right? So you go and you make it like you can do both, like for number 9 and for the bridge at the same time. That saves you time, and because it's like almost like mistake proof. And trust me, people do a lot of mistakes, make a lot of mistakes when they are doing this. And something that I used to tell about CDCA is like every step counts, every step is important. If you're not doing the current step well, like this one, if I don't do a nice putty, my putty is going to, my mistake at this phase is going to contaminate the next and the next and the next phase. Why? Because this is important to help me to do self-assessment. With self-assessment, this is very useful, okay? With self-assessment, you can know that how much you still need to prep, how is the directions of your prep, if you need to go more, if you need to go less. So this is really handy. So I wouldn't dare to try to do any prep without this, because this can show you, like for example, for the number 9 here, it's very common that we do 0 reduction at the cingulum area. we go with the concavity and then we go with the cervical, but then it's two different moments of prep. And then right here at the cingulum, when you put the putty, you see that you're almost touching or even touching the putty, which means that you have zero reduction. And that is like a main cause of reprove of failure during the exam. So now it's set. So I'm gonna remove it. That's fine. I'm gonna mix the other one. So that area of the cingulum is very common that people do under reduction, and you really have to do the minimum. You have to be in the parameters, right? So when they say that the minimal reduction in certain area is 0.5, I never aim that goal. If they say it's from 0.5 to 1.5, so my goal, I'm going to prepare right in the middle. I'm going to prepare at 1 because there is a risk of that people sometimes they are too conservative, and then we aim 0.5 millimeter, and then we end up with 0.3 and or 0.4, and that fails you. So same thing here, 2 fingers, then 1 finger on the top. I'm gonna show you that something that is important that I didn't mention the first time that I did is whenever you go this way, why it's important to work with 3 fingers at the same time, because you want to make even walls with the same thickness. You don't want to press too much here or too much here or too much there, because you want thickness of the walls. When you remove it, you want to see something like this. You have to have at least 5 millimeters of thickness all over and even on incisor. Okay, so let's trim this one while that one is setting. So the better way of doing this is with this cardboard cutter, right? So I would go here first. There are some excess here that I don't need, so you can trim that. I'll still keep a lot of gum to support, to contact here. You see, like I'm touching gum here and gum there. This is the screw for the number 8. So you go here, you don't want that screw interfering, because you see that you have a little cross like from inside of the engagement of the screw. Sometimes if you try to place in position and it doesn't engage well, especially because it was rotating a little bit, it won't fit properly. So you don't want that. So you eliminate this contact with the screw. You alleviate that. You cut in a U shape or in a V shape like this. Boom, you don't have the contact with that anymore. Sometimes something that can make it, like if you see that it's too big going to the other teeth right here, you don't need more than that. You can go to the disc of the premolar here, to the middle of the premolar in there, and trim it. You don't need too much, right? And now this is the first cut. What you have to do, first you have to identify where you have to cut. You need this right in the middle of number 9. Sometimes we misplace it when we take it from the cast or from the typodon. We don't know which one is which. So this is easier, because if you have this screw here, you know that this is number 8, the one that you're gonna do canal. So this is the one that you're gonna work. You're gonna do all ceramic preparation here. So what you have to do here, first cut, is just one cut right here, vertically, like at the long axis of the tooth, right in the middle. Try not to go this way nor this way, right in the middle, and try to go as parallel as you can to the long axis of the tooth. So when you cut it, you don't go with the blade like this or like that. And try to make in just one flat cut, like you go this way, look from above, like this way, cut it down right in the middle, flat, in just one stroke. That's it. That's what you need to see. So then let's see if the other one is set, almost there. So you see good thickness. This is what you have to see. Good thickness, no void whatsoever. Contacting a good portion of the gum here and there. Good thickness here too, and here, right? And right in the middle. So this can show you when from a lateral view that now you have zero reduction. So I'll show you. I'm going to place in the typodont that I'm gonna first, before zero reduction, I'm gonna show you how to check that at the end. For example, this is a prepared tooth and it's ready and is exactly at the parameters that you're supposed to be. So if you place it, another thing, sometimes the embrasures kind of prevent you to fit well. You don't need embrasures, okay? So if you want, you can cut out these engagements of the embrasures, okay? That's gonna make it easier for you to engage the putty in the right position, okay? So of course I did this in one typodont and I'm trying in another one, so there might be a little bit of a difference, but let's see how it goes. I think I touched here with my, yeah, just ruined it. So you see, you make mistakes all the time. So what I want you to see is like this. Whenever you're looking from the side view, what you want to see is like this. We can use the other side. I ruined this one, but we can use the other side. Whenever you're measuring anything here, like you want to see your buccal wall, for example, let's take this piece out. So you see that is not completely engaging down here. If you don't press your finger and close that gap, you're gonna have misreading right here. Okay, so it is very important that you press your finger here when you're reading that surface and press your finger the other side to close it. Then you can measure if you have that 1 millimeter all over. And then you're gonna check if you have the 2 millimeter at the incisor. And then you're gonna check if you have the 1 millimeter on the concavity. And that's the cingulum. Here we could have a little bit more reduction. And then down there, make sure that it's touching like this. And you have to have 1 millimeter here. And you have to have 1 millimeter of high minimum. Here I am at 2. Okay, so that's the putty. We can take a look with the other side too. We place the other half of it. So since I didn't ruin this part, so you can see exactly those are the parameters. And this is a goal. You see this line was the zero reduction and it goes like the first inclination, which is the cervical, and then second inclination. So at the end, your prep should be kind of that same way, parallel to it. So you have one surface here that goes exactly like that, and then you have another inclination here and it goes exactly like that. Then you have the incisor that should be 2 millimeters, and then you have all the lingual. So as I said, it's common that we do prep, and if you don't have the putty, you think that you did the proper reduction here at the cingulum. Like here, for example, is a little bit more than 0.5. I would go more just to make sure. It wouldn't fail at 0.5, but I wouldn't aim that. I would go with this wall a little bit more with more taper. And then, so you're gonna do this self-assessment all the time when you're preparing all the walls. Okay, so now the other cut that I need to do, I don't use that much for reference when I'm prepping to do my self-evaluation, my self-assessment. but they request you to do it this way. So the number 8 came out with the putty. Place it back, tight the screw in again. So here you do the same thing with that thing of the screw. You can remove some excess here. You don't need all of this. And then the screw, you go and you cut it out like that. A little more. Okay. So this one, you're gonna cut in a different way. So as good as the other one, the thickness here on Baco and Lingo is fine. Now this one, you can cut some excess here. You don't need premolars. You can go to the distal of the canine. And then the other side, same thing. Then this one is gonna be trickier to cut, and that is better with the blade. Let me get a blade here. Because a blade's gonna be more precise when you do it. Because the blade is smaller and you need to do a curvature. This cut is going to be following the incisors like this. So you're gonna go cutting in the middle of the incisor all over to separate two portions of the body like buccal and lingual one. And you have to do that right in the middle of the incisors. So you have to look from above and you have to follow the curvature of the arch, right? And go on top of the incisor. So let me do here. It's kind of tricky for me to do and film at the same time because either I see through the cell phone that I'm filming or I go directly. So, and then the angulation is not ideal for me. Okay, but this way. So you go, you aim the incisor of the canine, incisor of the lateral, and you keep going the incisor of the central, and then you're doing like a curvature, and then incisor of number 8. Tricky. I don't see what I'm doing. Okay, now I am. But then I don't film well. Let me try. Okay, got it. That's it. Like that. You just separate buccal from lingual like this. So what you need to see is that. I don't use that myself to do my self-assessment when I'm doing prep, as I told you, but they do, so that's fine. So they want to see this way, and they want to see from lingual like this. So pretty much that's what you need to do with the putty. Of course, if you get the checkmate from Accidental, I have an old checkmate here that is just like segments. That is for the number, just for the anteriors. Checkmate is like this one is just for the anteriors, but the other one goes all the way like this with segments like that you can cut later, and you can do all of that at the same time. What this does is helps you to make it easier. So you mix it and you place here at this line right there. The other one is a little bit different than that. And this one is broken. It broke right here. So, and then you go, in this case, you have to aim a specific area where it engaged, which is the middle of number 7, and then it goes all the way down. Once it sets, you can go and disassemble it like this, and then recover the putty and cut, and it's going to be with a nice shape. And you're also going to have the numbers printed like 7 to 12, something like that. Okay, so I do recommend to get that, because anything that, I think it costs like something like $20, 20 something, anything that makes you to save time during the exam, I think it's good because of the time management, as I said. Okay, so this is the end of the number 9 putty video. Now I'm gonna do another one about the number 3 and 5 bridge.